like it's actually working, and we're actually engaging community in order to protect not just ourselves but the rest of our folks. So my name is Sofia Sepulveda, and I am the lead healthcare organizer with the Texas Organizing Project. And the last 100 days we've seen how the COVID relief package has really helped the American people, as well as providing expansion for Medicaid. We've seen how they opened the exchange in order for more folks to be able to get access to healthcare, especially during a pandemic, which we saw in the previous administration that wasn't possible. And we also see how the new president is pushing for 90% give back to states who have not yet expanded Medicaid, which is a huge win for a lot of us, especially Texans who are we're still fighting to push for Medicaid expansion. So I think that so far the work of the organizers have been super visible in the way that the current administration is legislating. I met a woman who had thyroid, who was sick of, she had a thyroid condition, and she had not taken her medication for over a year, right? So these are real stories from real people, and I feel right now there is a hunger for change. I keep on hearing it's almost time, we're almost going back to normal. I don't want to go back to where it was. I want to go back to better, not normal. I want to go to get better in our communities, because our community, at the end of the day, we know that Black and brown people are the ones who are suffering the most. A little bit of explanation about Medicare for All. Medicare for All would mean expanded Medicaid, right? We know that the Medicare program right now is very restrictive, right? It doesn't provide access to vision and dental, long-term health. So Medicare for All would actually provide you visual, dental, and long-term care. We also know that Medicare right now takes away $100 to $120 from your Social Security check. This will no longer happen with a Medicare for All system. We no longer will have to worry about premiums. We don't have to worry about out-of-pocket expenses. We don't have to worry about deductibles. We can see the doctor for no cost at the moment of service. We can also start negotiating with pharmaceutical companies in order to lower the price of medication and provide access to healthcare to everybody from cradle to grave, right? Everybody in, nobody out. Right now, we know that with the private insurance, it's very difficult to not only access healthcare, but locate a provider, right? Medicare for All will allow you the freedom to get the provider that you want, go to the hospital that you want, travel anywhere in the United States and get access to healthcare at no cost. We know that if you go from San Antonio to Corpus Christi, which is 3 hours away, you need to have an insurance in Corpus Christi in order to be covered. That will no longer happen during in a Medicare for All system, because Medicare for All will be a nationwide healthcare plan, and this is amazing, right? We still need to fight for better coverage. We know that trans healthcare is still being negotiated, but it is a part of the fight. So even if it happens, even when it happens, we cannot stay asleep. We cannot fall behind. We have to continue pushing for a better system than what we have right now.